Around the world, a mysterious killer is on the loose.
There are a lot of uncertainty with this COVID-19.
It's a new and unknown enemy.
Virus can be anywhere. You can be sick or you can be die.
We have to be prepared for the worst.
Singapore is ready for battle.
The best way to deal with an outbreak is to act preemptively, to act early.
When crisis hits, unity means strength.
There's every reason to be positive.
No virus is stronger than the nation unity.
January 2020. In the lead up to Chinese New Year festivities,
Health authorities in Hong Kong, Taiwan and Singapore are stepping up prevention measures at borders and hospitals in light of the viral pneumonia outbreak in Wuhan, China.
within days, what's now known as COVID-19, formerly the 2019 novel coronavirus, hits Singapore's shores.
We have confirmed the first case of Wuhan novel coronavirus patient in Singapore.
It's February 2020, a month since Singapore's first case was reported. At the city's hospitals like Tan Tock Seng, it's all hands on deck. Most staff here on an enhanced pace since the outbreak started. Their dedication is contagious.
Are you here for visiting a patient or do you have a doctor appointment?
I'm here to visit.
Okay, I am deployed together with other staff from other departments to conduct travel and health declarations at the entrances of the hospital.
Thank you.
We are done.
Thank you.
We need to support each other. So much you can join the priority queue.
All right, okay. Thank you.
I feel honored to be here. Work together with our fellow colleagues to keep everybody safe. My family is supportive, especially my husband. He said, go for it. It's part of you. You should just go ahead and do it. You have my support. I'm proud of you.
Hospitals are at the front line for testing. More recently, a network of almost 900 public clinics has also been activated. They're called Public Health Preparedness Clinics, or PHPCs, and they act as a strengthened line of defense during public health situations.
PHPC clinics are ready to deal with this crisis. We have been taught how to deal with pandemics. We know how to take care of the safety of the patient as well as our own safety. And having peacetime training is useful during these emergencies. As we get activated as a PHPC, we were given priority over certain protective equipment, such as masks, gowns, as well as gloves.
Hi. Can we fill in with some friends?
We set up separate triage areas to discern the patients, the high-risk patients from the low-risk ones, and we seat them separately.
How long have you been coughing for?
Few days.
Okay, so you're not too worried about that.
Okay.
Anyone at home having this?
Besides the history, we look for signs, for example, that they have respiratory distress, or they could have signs of pneumonia. We then decide whether a patient is a high-risk patient that require further examination, and then we send to the hospital if they need further investigation. It allows us a better way to maintain surveillance over patients who are presenting with the symptoms of flu or cough, so that we have better data and statistics to monitor the situation. Having PHPC clinics in the community really helps because in terms of accessibility of services and then also preventing patients from going to hospital unnecessarily. And having PHPC clinics to do this job is better than to have patients, for example, mingle in the hospital and catching unnecessary infections.
Meanwhile, at Tan Tock Seng Hospital, security guard Sarwan has new responsibilities. Patients who have tested positive at the hospital are transferred to the nearby National Center for Infectious Diseases. Sarwan's job is to supervise these transfers.
Some patient talk to me about their problems. Some patient in front of me also cries. What I can do is give them moral support. My wife, my kids, my mother and my sister, they give me moral support to me, make sure you help anyone, make sure safe.
The National Center for Infectious Diseases, or NCID, is the epicenter of crisis management.
There are a lot of uncertainty with this COVID-19, and what we do is really to actually listen to them, lend our listening ear, and really to actually empathize with them, to be with them when they have certain concern, really just to hear them out. This will actually comfort them, rather than just brushing them off and getting things done. Yeah, and that will actually alienate the patient. Yeah, because we are just treating the disease process rather than treating the patient as a whole.
Patients are treated in so-called negative pressure rooms behind double doors. Only fresh air can come in, and only clean air goes out.
This actually protects the community that is siding near the building itself, and to assure people and the general public that they are very safe where they are staying. So this is our assurance to the general public, and also our commitment in terms of protecting the lives of Singaporeans.
It's not the first time Singapore is fighting an epidemic. In 2003, staff here fought the Severe Acute Respiratory Syndrome, or SARS.
Building on our SARS experience, we saw about 300 over patients back in SARS, and this was why we actually built this building to actually to hold up to 300 over patients. But in case of need, we can actually scale up to 500.
Over at a much older institution, the 94-year-old College of Medicine building, a special team from Singapore's Ministry of Health has been working tirelessly to help contain the spread of COVID-19.
Saturday, correct. Do you work on Saturday as well? Or okay, so it's your off day actually.
Are you currently well? Okay.
During normal peacetime, our role is in the surveillance of infectious diseases of public health concern and response towards these diseases. Currently, with the COVID-19 outbreak, our role has been transformed into that of the contact tracing center.
Contact tracing is an extensive process.
Okay. Were you well in school?
So that's the session with your personal trainer.
How do you spell that?
And after that, then you go for...
The team's role is to find out where these patients have been and who they've interacted with. In some cases, this detective work has also helped reveal the source of infection.
If we are able to identify all contacts of a case early on, before they develop symptoms, then we will be able to break the chain of transmission. And also by identifying contacts early on, they will be able to be referred for medical assessment as early as possible. So far, we have managed to link up most of the reported cases. So as long as we are able to establish linkage with previously reported cases, we are quite hopeful that we will be able to contain this.
Another high-risk group, people returning from areas with a high number of cases. As a precautionary measure, they'll have to remain in their homes at all times for 14 days.
We have a multi-level defense system, and one of the first levels is to try to reduce the amount of importation of cases into Singapore. The logic is that if you have many cases imported, then they are likely to create many clusters of local transmission, and then the overall public health response will be much more difficult.
Local transmissions are kept at bay. As of 3rd March 2020, the tally of cases number over 100, with 30 remaining in hospital. None are from community spread.
So far, we've extended our surveillance very greatly, and we haven't seen any evidence to suggest that wider spread community transmission is occurring. And this is because we were able to identify patients early, to identify contacts, and to ring-fence these local clusters of spread before they can transmit to the wider community.
A regular press conference regarding coronavirus disease, COVID-19.
We're very impressed with the efforts they're making to find every case, follow up with contacts, and stop transmission. Singapore is leaving no stone unturned, testing every case of influenza-like illness and pneumonia, and so far they have not found evidence of community transmission.
In any battle, knowledge is power.
But 8 are in critical condition.
A multi-ministry task force spearheading crisis management of COVID-19 gives daily updates. The aim? To inform the public about the situation as it unfolds, good news or bad.
We have to be prepared for the worst.
But it's not.
Crises can breed speculation and conjecture. The task at hand is to prevent panic.
We are learning more about the virus every day. And as we get more of this information, we will share it with everyone so that everyone is informed and updated of the latest understanding of this virus. And we will also reassess and update our strategies to deal with this evolving situation.
In an era where social media trumps by speed and shares, timely announcements are critical in fending off rumor and misinformation. That's where the Smart Nation initiative comes in.
My role essentially is to help to deliver government digital products for citizens.
A new digital product would help in the delivery of a key item in the real world. With public concern rising, the government announced it would give 4 surgical masks to each household. That's 1.37 million households across the city. But people needed to know where to pick them up. And all this happened in the middle of the Chinese New Year long weekend.
I started calling our engineers for SOS. Right, so they came by office about midnight, and thereby our brief was ready to come up with a website to get citizens knowing where to collect their masks. We have less than 24 hours.
So let's try whether the map location works.
The first 3 days, the stats was about 900K views, which is quite surprising. How the whole team felt about this exercise was really very meaningful. It was during the Chinese New Year weekends where a lot of them were having activities, visiting, but they all let go of that and come to help make sure that this exercise went on successfully.
The site is called maskgowhere.sg, and it's now been expanded to include information on public health preparedness clinics. Elsewhere in the world, cases are on the rise. On February 7th, Singapore raised its alert status to DOSCON Orange, leading to some scenes of panic.
NTUC FairPrice has tripled the volume of supplies to stores a day after demand for essentials surged by about 5 times.
We have been increasing our supply runs. In fact, it's gone almost 3 times more than the usual. There's really no need to create our own little stockpile at home. Because when you do that, we just add strain to the system.
I think there's no apocalypse going on, so there's no need for us to hoard any of the things. Yeah, there's continuous supply. They are not stopping any trades, so we will definitely still be able to get things off the shelf.
Fear can do more harm than the virus itself. It can make us panic or do things which make matters worse, like circulating rumors online, hoarding face masks or food, or blaming particular groups for the outbreak. Instead, we should take courage and see through this stressful time together. Let us stay united and resolute in this new coronavirus outbreak. Take sensible precautions, help one another, stay calm, and carry on with our lives.
February 7th, 2020. It's 2 weeks since the first confirmed COVID-19 case in Singapore. The tally rises to 40, and the alert status is raised.
Today, the task force has deliberated carefully and decided to raise the risk assessment to DORSCON Orange.
Moving to orange means we should heighten our vigilance, that we should step up our measures, but it does not signal that things are getting out of control. And it's very important to understand this because the best way to deal with an outbreak is to act preemptively, to act early, rather than late in the response. So many things need to be stepped out ahead of time in order to have effective control of the situation.
Around Singapore, anti-infection measures are stepped up. Singapore's transport workers are doing their part to keep everything on the right track.
We think that travelling in SMRT is still safe. The reason is because we really step up the way we disinfect the major touch point. And if you're a passenger travelling in our system and you're not feeling well, our station staff will come to you, they will put on their mask and glove so to take care of you.
Commuters aren't the only ones being taken care of.
There are many types of masks in the market, correct?
Frontline staff, too, are getting the necessary tools and knowledge to ride out the crisis.
We will actually arrange for doctors to come to a certain crew point and some home base to talk to them, give doctor talk. So when they have questions, they can ask them personally. We actually try to allay the fear of the frontline staff and to assure them that working at SMRT is okay. You just need to be healthy. You take care of yourself, you take care of your passenger, it's okay.
Such measures give Assistant Station Manager Rohaza peace of mind. She works on the East-West line. It's one of Singapore's busiest train routes and also serves the airport.
As a frontline, I am concerned about the outbreak crisis, but then I do confident for me as a frontline to serve the passengers, no matter is whether they are well or unwell.
This confidence is shared by bus captain Michael Lowe.
All staff, before they start work, are to take the temperature first. Secondly, buses every day are being disinfected. And each trip, when we reach the interchange, all doors and windows, after parking, is being opened to let the inside air to be filtered out first. It is very safe to take our buses.
The same rigor is applied to precautionary measures at the city's points of entry. More than 1 million people pass through Changi Airport every week.
And it's not just cleaning itself, but also disinfecting. Some of our high-touch surfaces, we have also applied a protective coating. So the disinfectant coating actually, what it does is that it helps to kill the viruses and bacteria that lie on the surface. And this can last from 3 to 6 months. So that will help to keep the airport clean and safe.
Cleaning and disinfecting work has doubled. at the terminals and connected spaces, including the recently opened Jewel. That required Ko Hwan Young to put in overtime shifts almost every day.
到了目前呢，我的工作啊，我觉得我的工作更加重要。虽然是辛苦啊，虽然是要用一点功，多一倍的功，但是我们的责任还是在那边。啊，我们也是觉得很高兴，可以达到我们所要做的东西。
That dedication extends to everyone here at Changi Airport.
We are doing utmost to keep the place safe and operating as normal. In terms of the safety, I think we have definitely put in sufficient precautionary measures. We have also stepped it up. I certainly feel that together as a team, we'll be able to work through this crisis together.
Here at MasterCard's Asia Pacific headquarters, business contingency plans kicked in during the early days of the outbreak. They are reducing large face-to-face meetings and non-critical travel. Shafi Sheikh is the head of the Regional Crisis Response Team.
We are making sure that our people do not panic and they do not take any knee-jerk reaction to the situation, and they are being provided the right guidance by our teams. So for us, it is mostly business as usual. In fact, most of the critical projects and initiatives which we are working on, none of them have been impacted so far. They're all running as per schedules.
The business district might look a little quieter than usual. But behind the scenes, everyone's in the fight together.
I think if everybody does their job, which they are supposed to be doing and cooperating with the government, I think this crisis can be handled and we would possibly see normalcy returning back soon. The strong response from the Singapore government is highly commendable and is setting a very high benchmark for the rest of the countries to emulate.
I don't think anybody in business doubts for one moment Singapore's abilities to cope with COVID-19. Everybody I've spoken to has been very complimentary about the way COVID-19 is being managed in this country. So in terms of business confidence in Singapore, it remains high. Obviously, people are struggling with the effects of COVID-19, but that has got nothing to do with Singapore. It's got everything to do with managing a crisis, and businesses survive and grow and learn, like governments and communities learn and grow from crises. So I think there's every reason to be positive.
Sentosa, the party island of Singapore, looks a little too tranquil these days. On the island's prime beachside strip, businesses are feeling the heat.
The impact is actually quite big. Our business has dropped almost 70%.
Tourism numbers have plunged in Singapore, despite measures in all hotels to disinfect and stay virus-free.
Every hour cleaning, wiping down, So I saw that some of my leaf button was showing a bit of rust stains because of the bleach.
The outbreak will certainly impact our economy. The tourism and aviation industries are most directly affected. I will introduce two special packages with a total budget of $5.6 billion. The first is the Stabilization and Support Package. This will stabilize the economy and support our workers and enterprises by helping workers to stay in their jobs and enterprises with cash flow.
Under the budget, hotels will get a faster write-down of investment in renovations. They'll also get rebates in property tax.
It comes with the queen bed and the single bed. Yeah, this actually allows us to sell this room for more people to stay. This budget actually allows us to also redesign some of our rooms. Since this downtime, right, we are able to very much isolate more rooms for this renovation.
Before the guests come, this is called pre-service.
Hotels will also receive subsidies for training workers.
You always put yourself in a guest room.
The budget allows us to reconsider how much this training funds we can allocate. We employ a lot of special needs. We always have to conduct training, you know.
Thank you.
I'm confident that together, we will stay strong and get through these trying times.
This is only for the short term, this virus. Very sure that we are able to go back to the type of occupancy that we used to enjoy.
It's just before noon. Staff at this restaurant are preparing for the lunchtime rush.
36. 35.
In the restaurant business, good health practices and hygiene are priorities. Now, even more so.
I'm Galvin, so I'm an assistant manager of Darkland PLQ. So remember to wash your hands later after you don your mask, so prevent your saliva from dropping onto the customer or onto their food. Okay? First thing that we do nowadays, we have to do sanitizing. Like we wash our hands, sanitize, so that we make sure the place is fully clean.
Their measures to curb the spread of infection extend to patrons as well.
35.7. Thank you. Welcome to Darkland. Most of the customers that comes here, they say that this place makes them feel safe. So coming here with these measures being put up, they come back again.
Maybe then if there's enough orders.
Many businesses have taken a hit. Most try to make the best of a rough patch.
The biggest challenge, I would say, is to help save jobs. For every employee that we have, there are many people in their household who depend on them, and we are talking about livelihood here.
Our biggest asset is our exceptional people. We have come together and weathered many past storms, like the global financial crisis, SARS, and now the ongoing COVID-19 outbreak. Budget 2020 is a strategic financial plan to prepare Singapore and Singaporeans to meet these challenges and seize new opportunities.
Despite the storm, Singapore keeps going. Everyone, everywhere, steps up to do their own small part to battle the virus, down to the very youngest.
Hello.
It's the start of another school day. Many of these children come from the more than 1.6 million strong foreign community in Singapore. Everyone here knows the routine. But today, there are some new lessons to learn.
The newspaper telling us that the virus is now in Singapore. Coronavirus can make us sick. It can make us have a runny nose. Also, it might make us cough. How should we cough if we need to? Into our elbow. Very good. So it might sound a little bit scary, but lots of doctors and nurses are working very hard to make sure that anyone who's sick can get better fast.
My name's Sarah Mackenzie. I'm from Aberdeen, Scotland. I'm the core teacher here for the Nursery 2B class.
Here is a picture of how the coronavirus...
Sarah's job is to instill life lessons and to build confidence among her young wards. She has new lessons with those same themes in mind.
The virus is depicted as a kind of monster in the book, so that's very interesting to them. And they'll ask questions like, is the virus going to eat us? Is it going to get us? And that's a good way for me to explain to them, like, no, it's not going to eat us, but it is something that we need to be careful about, and we can discuss ways that we can keep ourselves safe from the virus. And it's good for all the children to discuss together, and like, oh, if your friend feels scared, how can we help to reassure them?
Tops and bottoms, in between, washing all around, nice and clean.
Learning about the virus goes along with new routines, including some for those who couldn't come to school.
So all this was put together in about
Awesome.
24 hours by the pedagogy team.
Wow, that's really good.
And
Yeah, that really shows families that we're thinking of them and caring about them. So.
Staff here developed a home learning kit for some pupils on leave of absence. The kit was so well received that they decided to produce more to help lower-income families in the community who might be quarantined.
our charity actually came together and we made these home learning kits for these students. So 60 learning kits were made in about 48 hours and they were sent out to NTUC schools. What we're trying to do is kindness during crisis. Because from a child's point of view, when you go to NTUC and you see all the toilet paper is gone, it must be quite scary, right? As a child, it's like, what's going on?
Helping the community to fight fear. From the youngest to the elderly, how Singapore is coming together. Singapore settles into life under a heightened virus alert. Life and work go on. So does the learning.
We want the children to understand that despite the situation right now, as long as all of us have the common faith, we do our part to keep everyone safe, we are able to overcome this crisis.
Wan Jun and Pavitra are form teachers of a primary 1 class.
If you want to fight the virus, wash your hands, wash your hands. If you want to fight the virus, don't touch your face, don't touch your face. Healthy meals and exercise. Okay, let's ask Shanice.
Virus can be anywhere. If they spread inside your mouth, you can be sick or you can be died.
Pupils learn the basics about protection. Fear can be worse than a virus itself. But talking about it can help.
I'm scared my family died.
In class, we actually go through about feelings. So when they share their feelings, we really reassure them and tell them, there's no need to worry. If we take precaution measures and we practice good hygiene, everyone will be safe.
We find this is such a good opportunity for us to actually inculcate in them the values such as responsibility and resilience. Responsibility in terms of you being responsible for yourself, your own hygiene, and of course the social responsibility towards in keeping your friends, your family members safe.
There are some changes to daily routines, like staggered recess times. One of many contingency plans designed well before the outbreak.
Solving one-step word problems.
If schools have to close, we will still use Student Learning Space as a platform to upload lesson packages so the students do not miss out on any of their learning. If they click on the wrong answer, they will have feedback.
There are life lessons too, such as showing appreciation to others in the school community.
Can you show us your card? What would you like to take? The security guard.
Thank you to security guard. What do you want to say?
Taking our temperature.
Giving people of all ages the tools to protect themselves against infection. It's a familiar message by now, but this time recorded in local dialects. It's the work of Eugene Lee and his wife Ski. Eugene is a former banker who set up LearnDialect.sg to invest in social capital between generations.
We're thinking in our hearts, what happens to all these seniors that have no idea, don't speak English, nor Mandarin, and usually mainstream media, when they're reporting about coronavirus, it's always in terms of English or Mandarin. And we thought, actually, outside the nursing home, dialect-speaking seniors would also benefit. It's only when they protect themselves that, the society becomes safer.
Another community group takes that message out on the streets.
I let you own one mask, all right? But the mask, remember, is only when you are sick.
This is Operation Hands On. Volunteers go from door to door in HDB estates, handing out masks and hand sanitizers. They also educate seniors about the virus, with the help of Eugene and Ski's dialect videos. Delane Lim has himself been affected by the virus fallout. He runs a business organizing enrichment courses for school students. But such activities have been cancelled due to virus precautions. With business down, Delane and his staff are instead doing their part in the community.
They're also concerned why everyone is wearing masks, and they feel that there is a level of insecurity when they don't have any masks. So that's where this campaign, Operation Hands On, came about, because they received a lot of news from their children, from their grandchildren, from their peers, and realized that they are very confused with the news. Some even thought that there were a lot of death cases in Singapore. So this whole exercise is to educate them. It's really about assuring the elderly.
Scenes like these are being repeated across the island, as citizens step up and rally together against a new, silent and dangerous enemy.
If every one of us do our own part, whether in big or small ways, these little parts that we play do strengthen the country resilient. And I always believe that no virus is stronger than the nation unity.
In Hokkien, we have a phrase to say, "Ai zai, mai kia," right? So, which means to stay calm, right? Don't panic. I think that's would be a first kind of best response, right? To see how each of us can work with one another in order to ensure that we come out of this together stronger as Singaporeans.
Businesses on their own accord have come up with creative and quite moving solutions. Ride-hailing operator Grab has a new service for healthcare professionals. It's to help them get an easier ride from hospital to home. Gabriel Go is one of the 4,000 drivers that have signed up.
We do hear, some healthcare workers sharing that they may have a difficult time getting a ride home and so on. So I hope I'm able to do my part and bring them home safely. I really hope that the public do not discriminate them and appreciate what they have done. And let's do this together as a nation. We'll be able to get through this tough time together.
And during such times, there's extra attention to hygiene. It might take a little extra time and effort, but Gabriel says it's worth it.
Oh, the feeling, shook. It's always happy that you're able to contribute to the society. The feeling of being able, to be part of the GrabCare program is fantastic, seriously.
While healthcare workers keep their morale up on the front line, there's also a heightened response from a different group of medical workers.
So of the 3 genes now, do you know which ones we would choose as the final?
The best candidate now for us is the RDRP.
Acumen is a Singapore-based biotech company. They develop genetic molecular diagnostic tools to help hospitals test for illnesses like sepsis. But now, the focus is on coming up with test kits for COVID-19. It's part of the international scientific community's response after Chinese scientists completed the virus genome sequence and shared it with the world.
We went very fast on that as soon as we got all the raw materials in, including running tests through the night up to like 3 a.m. And the weekends as well.
Within 3 weeks, Dr. Ong and her team had developed a test kit.
This is a sample that is provided to us, extracted by another lab in the hospital and provided to us. It is taken from the throat as a throat swab. We will start to introduce the sample into the reaction plate, and then it will be introduced to the machine for analysis. We hope to manufacture about 200,000 tests, starting with the first batch of 40,000.
Dr. Ong is also exporting the kits to countries in need. It's one of at least 3 Singapore-made kits to test for the virus.
The leaders from the government sector, the businesses, the R&D sector, the innovation sector are all coming together. We are all addressing the issue with the right tools, such as technology, medical knowledge. So I think the public education, as well as these tools that we have, will allow us to not panic and be able to contain it successfully.
We continuously adjust our risk assessment based on global and regional developments and adjust our measures accordingly. We will not hesitate to take further decisive measures to keep Singapore safe as the situation warrants.
Singapore will survive this, will get through this together.
Only time will tell when the war against this new virus will end. But keeping spirits high is the belief that together we will be stronger.